Hi, welcome to Public Health Week. My name is Joel Payton, and thank you all for showing up today. Today is going to be a really exciting week. We're excited because this is really introducing one of our ERGs, newly formed ERGs, people of color. And what I want to talk about really quick this morning before we introduce Ben is the importance of an employee resource group, just in case you guys have never even heard of what they are. What they do is employee resource groups pull out the talent from organizations to help organizations solve complex issues of, let's say in our case in healthcare, with finding those groups of people who may be underrepresented within our communities. So they pull out their talents, we use those talents, put them in leadership positions, and solve those problems of underrepresentation that sometimes may happen. Have you heard of organizations like Google, Microsoft, AT&T, Johnson & Johnson have all used this tactic to their enormous success. So these events in finding that talent does work and is very productive. So when you hear of a group forming or meeting, take the time to maybe one day just attend and see what it's really about, because everyone's involvement is extremely important. As far as our employee resource group called People of Color, it means we are inclusive to every culture, every race that will be involved to help us solve our complex problem of underrepresentation. Today in our Health Week event, we are going to listen to our presenter, Ben, but first we have announced, and we're going to introduce Heather so she can introduce Ben and see what his message is for us today. So thank you. Heather?
Just a little background on Ben and what we're doing for Public Health Week this week. The theme is helping to change our future together through health equity and cultural responsiveness. And this was a great opportunity to bring Ben in. He's a strong advocate for civil rights and health equity. He's always focused on making connections between racial and ethnic disparities and promoting and fostering a space for productive conversations to happen to kind of fix some of the problems that exist there. Currently, he holds a position with Multnomah County as their, the Health and Equity Officer?
Chief Diversity.
Chief Diversity and Equity Officer. And prior to that, he wore many hats. I started in 2004 as an environmental health, community health worker. He was a health educator, a policy analyst, and a manager of the Health Equity Initiative. He is the founding board member of Opal Environmental Justice here in Oregon, an organization that organizes low-income and people of color to build power for environmental justice and civil rights within their own communities. I volunteered for that organization. It's a great organization. And he also serves as chair of Oregon Governor's Environmental Justice Task Force and the chair of Oregon Public Health Institute's board. He's going to speak with us today about some of the challenges they've had with introducing health equity work within Multnomah County and how that's fun for them. So please help me welcome Ben Duncan.
One last test. Okay, that works. I'll probably be standing here. Hopefully, there's 2 mics. I'm not mic'd up, but hopefully that'll capture that. And I do hope to leave some time for questions at the end. So I'm going to start just a little bit about the slide, a little bit about my own background. I appreciate and had the opportunity to meet with the People of Color Employee Resource Group, and after that conversation, I really saw this opportunity. And this slide is, I always use it regardless kind of what I'm talking about, because it's quite literally a metaphor for the way I approach my work. So let me distract you.
Sorry, please ignore me.
I'll ignore you. It's quite literally a metaphor, right? Not just for the relationships or connections between our physical, social, economic, and relational systems and health outcomes, but it's also a metaphor, I think, coming out of that conversation for how we can bridge our connections of frameworks and approaches and policies, not just for our communities, but for our workplace. So that's some of what I'll be touching on today, some of our frameworks, our approaches, our strategies, some reflections on our work, but hopefully leave you all inspired around what you can do as Oregon Health Authority, Public Health Division, or wherever y'all are coming from in your everyday work to move this and advance equity work forward. Part of that analysis for me, I grew up, my father's African-American from Alabama. My mother is a white Jewish woman from the Bronx, right? So you can imagine, there's a lot that comes in with both of those things. But part of my own identity, and part of my own growth, and part of my own relationship to this work has been a lifetime of trying to understand where I fit in the context of these broader social systems, right? Navigating those pieces, and I've tried to connect that really deeply with the work that I do every day. So today I'll really be talking about kind of these relationships and across these systems. And I want to start with this concept. What do we mean when we say, we say Multnomah County racial equity? First, that the systems are relational and support all people, right? That the distribution of resources and opportunities are shared. It'd be nice if I could look at this instead of memorize. Third piece around meaningful engagement. I think this is an important piece I'm going to hone in on throughout today. Meaningful involvement means that you have the ability to impact and influence the outcome. And I'll come back to this concept because it's so critical to the work that I think we're doing in Multnomah County that I'm really proud of, and I think it's the only way that we address health disparities in communities. Right? There's an old adage in environmental justice that says communities that speak for themselves best protect themselves. Right? So what does it mean to allow the wisdom and knowledge that is inherent in communities, that comes with lived experience, to be able to come up with the ideas that are going to solve people's challenges? So I think in that introduction around the People of Color Employee Resource Group and employee resource groups broadly, that we have individuals that have the experience, wisdom, and knowledge to create solutions to the challenges we face, both in our communities and in our workplace. And again, I'll come back to that because it's such a central and core theme of what I believe creates change around this work. This next one, if folks, Sonali Balaji, who is an old colleague of mine, is the lead author of our Equity and Empowerment Lens, our kind of seminal document around equity, and I'll talk about that later. But she used to always talk about this concept of embodying equity principles in practice. And for years I'd throw it on a slide and be like, okay, I just say it. But I didn't necessarily really grasp what that meant. And I think over the last few years, I've really come to find a deeper connection to what this means. In part because each and every one of us in this room has the opportunity to be successful in this area. Every one of us in this room has the opportunity to be successful here. And I'll use, as both a modeling and I think part of my own healing, perhaps, use some of my own examples. Right, so I said I spent my whole life thinking about my racial identity, my whiteness, my Jewishness, my blackness, right? Exploring what that meant, exploring who I was. But one of the areas that I didn't do that with the same type of intensity is around my gender. Right? And so as I am doing this work, and I think it's important for all of us, and particularly if you're a leader, to talk about your own shortcomings and blind spots. I mean, I was socialized as a man. I played sports. I had locker room talk, all that stuff, right? I've been impacted and influenced my whole entire life to practice behaviors to have unearned advantage in everyday work, in everyday life. I have a beautiful 7-year-old, almost 8-year-old child who's a little black, Mexican, Jewish, Catholic, loves Jesus, and he celebrates Passover. He's amazing. My wife is an educator, a Latina, who does social justice and education work, a researcher, much smarter than I am, and definitely more attractive. But she and I, despite our work, fall into so many of these gendered patterns in our own home. Right? And even though we're doing this work where we'll sit down and say, okay, how can I take a greater ownership over Rudy's childcare this week, or getting him to school, or there's a late start, or run for the arts, or whatever it is. Despite even as I work more and more to make sure that my lived commitments in my daily life are more reflective of these values, she still has the list, right? But she's still coming up with the list, and I'm saying, okay, Ben will do this, Ben will do this. I'm putting a name on the spreadsheet, right? So the labor, right? The labor is not distributed. Even in our own home, when we do this work all the time, when we're out here talking about it, right? So I say that in part because I think for many families, if you are in families or you reflect back on your own family, you see the distribution of work and how that plays out. You see the distribution of who carries the mental and emotional labor in our families, often, usually mothers. Right? But that's work that I have to do every day, let alone in the workplace. Right? Let alone in the workplace. So even at home with the folks that I love more than anybody in the world, I'm still falling into patterns. I still have my own work to do. So I say that because I want each and every one of you to think about, what is that work that I need to do each and every day to try to grow and try to learn and try to push yourself to really understand what are these practices and principles that I need to be aware of. Lots of diversity classes around things like white privilege. What does that mean? And I could use my own example. I used to talk about brown privilege. What does it mean to be able to navigate white spaces because I had a white mother who taught me how? What does it mean to be a man in this world? That's work that we have to do each and every day. I think it's also work, certainly, that I see the potential and impact of employee resource groups helping to bring to this organization, helping to create spaces where we can talk about it and dissect it and ultimately dismantle these things that we know harm individuals every single day. In our homes, in our workplaces, in our communities. Right? That's at an individual level, and then you take it to the systems and you can see, and we'll walk through some of those impacts. And then the last piece around bold and courageous long-term commitment to unearthing racism's root causes and addressing barriers. I think those two pieces understand kind of our historical context that has created systems of oppression and racialized outcomes, and understand the barriers to doing the work that we need to do. And I'm going to come back to this in a little while around our equity and empowerment lens. One of the most key questions that we ask is, what are the barriers to doing racial justice work? Financial, legal, contractual, human beings getting in the way. We have to understand those things. We have to understand where there are really barriers and where there are hurdles that we can overcome. But I think for all of us, being able to call these things out, being able to have shared language and be able to articulate why this work is so important, I think is a critical role that each of us can play. Next week I'll be traveling to Chicago for 2 meetings. We're part of a national organization called the Governing Alliance for Racial Equity. I think in Chicago there'll be 72 jurisdictions from across the country who have made this kind of collective commitment to addressing racial disparities from a governmental perspective. Recognizing the founding of this country was built on white supremacy and racial injustice. And as government, we've been a part of that. We are all complicit as people in government. Right? So it starts at that place. Okay? Government's got us largely into this mess, and we have an obligation to work our way out of it. Which for me gives me great hope. when I see all these organizations coming together. But mostly when I go to these places, with Governing Alliance for Racial Equity, Policy Link, which is a national organization, does amazing work. What I hope to draw out of there is not just, you know, the tactics that somebody, you know, some brilliant person did in some other place, but it's really the inspiration to be with people that are talking about a vision of this world, of this country, of our neighborhood, of our workplaces that aligns with justice. I mean, Public Health Week around health inequities is all about people's ability to thrive, to reach their full potential. So I love those spaces, and I hope this is one of those spaces that if you all kind of go through this week and are inspired and motivated and learn from folks both in your profession and next to you in your cube, that you draw inspiration, that you see yourself as part of this broader movement of work that's making our world a better place. Now, try not to be too foo-foo, whatever the expression is. You probably can't read this slide, and this, you know, my technical abilities notwithstanding, I can't figure out a way to get this slide in a way that doesn't show up like that. I'll have to hire somebody at some point. But I'll walk you through it a little bit. So this is a slide we created a few years back called the African-American Health and Equity Life Continuum. And it really is a snapshot. You know. And there's two things to notice. One, at the bottom of this slide, you can see in the middle is a bar or a line, basically it goes from infancy to death. And at each point along that life continuum, that life course model for public health folks, you see disparities: infant mortality, prenatal death, diabetes, low birth weight, teen births, STDs, asthma, prostate cancer, mortality rate, not morbidity, years of potential life lost. All right, so each of those, as startling as they are, and you could put in other populations, you could do this across a number of demographics. As startling as that is, if we don't look towards the top of that slide, right, it's what you all would say call social determinants. We don't look at education, we don't look at income, we don't look at employment, health insurance, criminal justice system, and each of those ovals at the top could be its own day, long conversation. What are the roots of seeing a 4.8 times more likely to be incarcerated as an African American? I think the data is 1 in 3 black men will be in jail at some point in their lives. 1 in 3 people. Prison is not good for your health, right? Let alone the rippling impacts of what incarceration does to families, to children, to that individual's outcomes, the ability to get housing, to seek higher education, to get employment. Plenty of jurisdictions have banned the box. Okay, that's a great start. Multnomah County's done that a number of years ago. But these rippling impacts, if we don't understand the relationships between these things as public health practitioners, then we're not fully talking about public health approaches. We're not really talking about prevention if we're not talking about criminal justice, and certainly I'll talk about some more upstream pieces. But these type of slides exist to tell us that if we don't understand, right, if we don't bridge that relationship between social determinants, and this is, you know, for most of you, is old news. Yes, social determinants impact health. People of color experience disparities. What does that mean for our practice? I also don't need to explain the upstream parable to you all when we talk about upstream and downstream. You know, I was a health educator. You know, it's the old expression: "I eat right, you exercise, you wear a condom." Right? And that's be all right. Solve all of our issues. And of course, that's naive. Of course, when I was going into families and talking into homes of families and talking about access to foods and eating a nutritious diet, somebody says, "Well, I had to take 3 buses to get to Winco, where I can actually afford a week's worth of groceries, and I don't have the time, I don't have the budget, and I got 3 kids that are near pain in the butt." Right, so when we talk about these things, we talk about, you know, the downstream impacts. And what we do is healthcare service and health education and individualized service. And I'm not making an argument against universal healthcare. I'm not making an argument that your health insurance matters. April 11th, in fact, my cousin who went by Stoney passed away a year ago. He would have been 47 on April 11th. And it's a long story about how he got there. 47-year-old black man, had a good job, health insurance, mostly went on disability and so on. But when he passed, my dad said, if he had different health care, he'd be alive today. Right? And as personally traumatizing that is, the idea that we're going to solve our problems with health care and solve health disparities with health care is naive. That doesn't mean that for the Stonies of the world that we can't get better access and improved care and more responsive and appropriate. My kid was in the hospital recently for pneumonia. He's fine. Fast forward, he's fine now. He's running around. But I was in a meeting in Salem. I get a call from my wife saying the night before he was breathing kind of funky. And she said, well, we took him into the pediatrician. They're sending him in an ambulance to Dornbecker. So I'm driving back from Salem, Googling, don't tell. I thought he had the flu. I'm like, he's got the flu. This is a good public health message. These were, extenuating circumstances. So I'm like, kid's dying of the flu, can't breathe. So I'm freaking out. I get up to the hospital. Everything about that space made him feel like he was going to be okay. As soon as you walk in, the way they talk to you, the way they treat you, the images on their walls, all this stuff, it matters. I tell people the one place I talk to elected officials, I challenge bureaucrats all over the place, I speak to power all the time. The one place I feel smaller than anywhere else is in a doctor's office. I left there thinking, why can't I feel like Rudy did? Like, you're gonna give me a shot? I'm scared. Talk to me about it, right? Distract me, give me a lollipop. But if you think about it more systemically, right? What does it mean to feel safe? What does it mean to feel empowered? Right? What does it mean to have agency? I was at a health literacy conference just last week, and I talked about the concept of health literacy being your ability to have agency. Not just did I understand what these long, 5-syllable words mean, or do I know that I had to take this pill this morning, but do I have the ability to talk about it with my doctor? Do I have the ability to help make the decisions about my care? Rudy's 7 years old, and they had this research study. They were looking at this very specific type of pneumonia. The doctors actually talked to him. I was like, you don't need no consent. I can consent, right? But they talked to a child about understanding what does it mean to be part of a research project. What does it mean to when we talk about a blind study? That's agency. This is a 7-year-old kid. How that turned into that, but that's So as we move up then, right, if we do upstream work, we're moving ourselves from the idea that we're going to focus on individual. This is for public health, right? I think our clinical services, have some different obligations, but from a public health perspective, I think this is the way we need to be talking about this work. That we need to think about community empowerment. We need to think about policy change and policy advocacy. Right? I was imagining as I was leaving that health literacy conference, I was like, imagine if you got a prescription to go to a demonstration, a prescription to go volunteer next week, a prescription to go testify and tell your story in Salem, because that's empowering. Right? There's like-minded folks that are doing this work. The mention of Opal, that's what Opal's all about. We talk to folks, when I've been off the board for a number of years, but you talk to folks that are like writing a letter to the editor or writing their own testimony. It's like, well, I've never done this. What do I write? You write your own story. It's powerful. You are powerful because of who you are and what you represent and what you've lived. And these are folks for the first time. So they said, me? what I have to say is critical, that's powerful. And we talk about these concepts and frameworks in public health all the time. We talk about empowerment theory, self-efficacy, theories of change, all this stuff, right? But what does it actually look like? How are we practicing that every day? And I think, again, thinking about how you draw that parallel to what you do in this organization each and every day. What does it mean for the new employee to feel that same way that Rudy did? To feel safe, to feel like decisions are being made that are transparent and communicated to you, to feel like you have agency, to feel like you can impact the outcomes. And even at a more basic level, just to feel like you belong. I'll come back to that. When you talk about the power of employee resource groups, affinity is a powerful piece. I mean, we have folks literally in our Multnomah County that have said, if it wasn't for this ERG, I wouldn't be here today. If I didn't have a place where I was so isolated in my work, I felt alone, I couldn't talk about my life and my experiences, if I didn't have this place, I would have left. Right? There's a power there, and it's saying something about who we are and what we need as human beings to feel valued and to thrive and to have meaning and purpose in our lives. And a deep connection to each other. So we talk about social and economic policy change. It's not just, redistribution of wealth and reparations, which, we could spend some time talking about that and arguing for. But we also know that isolation is not good for your health. You all produce this data. So how do we look at social policy and economic policy that brings people together, that builds power? And mostly, if we don't address and understand the relationship of those root factors of racism, discrimination, oppression, lack of power, immigration status, you can make the list longer. And if we don't understand how that is literally killing human beings, then we're not doing public health fully. And the science is rapidly catching up. The trauma of racism shows up in your genetics, right? Epigenetics is telling us that racism, the experience of racism is literally killing human beings and altering our genetics. People talked about intergenerational trauma for a long time. People talk about how these things flow through generations, that we carry the pain of our ancestors in our DNA, in our bloodstream. Well, science is just telling us that that's true. I think that's powerful, but the question becomes then what do we do with that information? And I don't have all the answers. I can show you a slide. Click on it. Right? That's for you all. That's for the discipline to be actively working towards, to try to address. How do we understand, and then how do we address the impacts of racism on human health? And certainly, what is our individual role in contributing to a system that's deconstructing and dismantling that, or systems that are upholding it and uplifting it? Again, there's work that each and every one of us can do every single day to be a part of the solution. So I don't want to forget that when I'm talking about systems level change, is that each of us should leave these rooms saying, what can I do today, however small, to make a difference? The slide, the colors are maybe difficult to see for some folks, but this is a slide on targeted universalism. And I love this concept so much. We borrowed this work from John Powell, who's at the, Professor Powell is at the Haas Center at Berkeley. He's done a lot of work with us in Multnomah County. And John talks about this as Equity 2.0. John's also a brilliant man, so you can Google John Powell. He wrote an amazing book called Racing to Justice that I encourage everybody to read. But he talked about this concept of targeted universalism, Equity 2.0, where on your left side of the slide, you see that there's 5 folks at the bottom, and 4 of them are hitting barriers, right? Structural barriers that prevent success, with 1 person represented in this slide getting to whatever that success metric is. On the other side, what you see is the same barriers. The barriers exist, but they're not red anymore, right? They're green, and like a green light. But you see the pathways for those individuals are unique. So the two things I think John says around targeted universalism, why I think it's partly such a powerful frame, is that on the right side, it creates universal outcomes. So if we were taking graduation rates, these are not exact numbers, we don't want black kids to graduate at 78% like their white counterparts. We want all children to be able to graduate, right? 100%. We set a universal goal, a universal target for all of us. It's a shared goal, a shared vision. But we also recognize, particularly as institutions that invest in these type of systems, that what it takes for each individual child in that standpoint, or what it takes for different communities to navigate these systems and structures, the barriers are going to look very different, and we need to have targeted investments that meet the needs of those populations. My colleagues in Fairfax have this wonderful framework around education and racial equity. They say each child by name and by need. Right? Each child by name and by need. It's powerful. And it's our job to understand, and we ask these type of questions. How are people differently situated? As John said, in relationship to the social fabric. Because how we show up at the bottom of that slide actually is impacting how we're going to be at the top, if we ever get there. And you can imagine in your own data and your own work where different communities are showing up on that left side, and you can imagine what different communities could look like if we applied the principles on the right. So this is a really powerful framework. I think one that I'd say Multnomah County has kind of adopted. We're using it in a lot of different areas. That's for another day and another conversation to walk through it specifically, but I'll talk a little bit about it when I talk about our workforce equity work. So our equity empowerment lens, again, you can Google Multnomah County Equity Empowerment Lens. I don't know if I'm supposed to say Google. Is that an adjective? Bing it? Whatever, I don't know. Use your Internet Explorer, whatever it is, I don't know. But the lens is really, as it says here, it's a tool for discussion. It's a cool tool to help ask critical questions, to try to uncover, to try to explore things that we may not have thought of before. It's about quality improvement. And I'll show the tool itself. But I also think this last bullet, I want to be clear, because I think when we started this work and I would show up and me and Sinai would come in and like, oh great, Ben and Sinai are here to come and tell us all the things we're doing wrong. Which I did do that. But it's really about reinforcing best practices. It's both. We have to understand where our blind spots have been. We have to understand that policies often have unintended consequences. Some ways for folks that do a health impact assessment are familiar with HIAs, those tools. It's not a dissimilar concept. We have to understand what the impacts are going to be of a policy issue or decision before we make that decision. And what we would argue is that in order to do that well, you have to, and this again, you'll have to use your eagle eyes to see this. But in order to do that well, you have to be addressing these multiple areas. One, you have to include purpose. What are you trying to achieve? And if you actually find this tool on our website, you flip it on the back, it actually has questions around your individual purpose. Right? Purpose was brought in to talk about the concept of spirit, the root of spirit, to get breath. It was really about value and meaning. So we start with that. What is the purpose? What are you trying to achieve here? And then we ask these questions on who's positively and negatively impacted, and how are people differently situated in terms of the barriers? Are people traumatized, re-traumatized? Like these concepts of trauma that are so critical, and knowing that government over and over and over again has re-traumatized people. So we have to be conscious of that. Importantly, that we consider physical, spiritual, emotional, and contextual effects. I would dare say that you cannot work with, for example, Native communities without understanding the spiritual connection to their relationship with whatever work you're doing. That's an easy example. Right? You can take many of our communities, but that's an important concept. Not just spiritual from a religious or faith tradition, but spiritual of like what gives you meaning. Where do you derive meaning? What makes you feel alive or whole? Like, we have to understand these things as practitioners. When we talk about the process, how are we meaningful, including or excluding? And you all know the easy examples. Do we provide language services, translation, interpretation, closed captioning? Do we have childcare? Is it on a bus route? All those things. But importantly, also, how are we, when we bring folks in, including them in that process? Are we using Robert's rules? Whoever the hell Robert is. People are like, oh, second, why is people don't know that. We learn it as bureaucrats. But what does it mean? How do we run a meeting? How do you create spaces where people feel like they can actively engage, that they understand the process? Right? So we ask those type of questions. Are there empowering processes at every human touch point? Think about my experience at Dornbecker and think about the contrary experience when I walk into other clinics. I wait in line. Wait for my doctor, I sit there alone, doctor comes in, tells me whatever the hell they want to tell me. I'm too scared to say something. But how do we create those empowering touch points? And I think that's true in our workplaces as well. How do we look to empower employees, particularly our frontline folks, those who are most impacted in our workforces, to place. I think physical safety, right? Spaces in and of itself, we know our relationship with space is critical. I think importantly, how are we investing geographically? And statewide institutions have this conversation all the time. What do we know about the data? What do you know about the impacts? What do we know about the many pressures to distribute our resources geographically across the state? How do we make those decisions? It's not to say rural communities don't deserve money, or rural communities don't have issues. How do you make those complicated decisions? And I hope that these are the type of questions and tools that can help us grapple with that. But only if we have a strong purpose. If we're talking about racial and ethnic disparities, then we look at the data and we allow the data to help us move our resources. Talks about the environmental impacts as well as environmental justice. Certainly as public health folks, thinking about the disparate impact and environmental hazard is important. And finally, power. And this is one that I think is often challenging. At the most simple level, who's making decisions is who's accountable. I've been doing some work in one of our divisions, and we applied the lens and we had all these recommendations. I was like, well, who do these even go to? They're like, oh, I don't know. I was like, geez, probably should have figured that out. But knowing how decisions are made and who's making them is not always easy in government. It's often incredibly complex, right? Particularly with the overlay at the state, because you have a legislature that's also involved, right? It's not just your organizational hierarchy, not just the politics of your own institution, it's the politics across the state. And that can be really challenging. But it's important to know if you're going to drive or develop policy change. But I think this last one is, for me, the most important. How is the current issue, policy, or program shifting power dynamics to better integrate voices and priorities of communities of color? I talked about this as a racial justice frame. We lead with race because of those slides like the African-American Health and Equity Life Continuum. That the depth of disparities are pervasive and so deep and so long-standing around racialized outcomes, that's where we lead. It does not mean that we don't do intersectional work. It does not mean that we don't apply targeted universal frames across communities, but we lead with race. And I think it's notable that the first employee resource group is focused on people of color while also having a universal invitation. So I'm going to talk about this a little bit in the context of some of the work that we're doing. This is an exciting week. Thursday, I'm going to try not to get too far in front here. Thursday, we're going to a board with a strategic plan. We'll be asking the board to adopt a workforce equity strategic plan. It's, I believe, the first one in Multnomah County's history. Maybe not. Makes me feel good to say it's the first one because I'm doing the work. But I think what I want to talk about is not what's in the plan. So, Thursday afternoon, Friday, we can distribute it and put it on our website. Not what's in there. Because the strategies you all could come up with, you could probably, if I asked you to popcorn, you could probably name the things that show up in a workforce equity strategic plan. But what I want to focus on is the process and practice. These frameworks of equity and empowerment, of targeted universalism, of safety, trust, and belonging. Right? That's our purpose. Those are the frameworks and approaches upon which we use. So what does that mean? In the bold, centering the voices of those most impacted. So we know, and you probably have this data if you do this type of analysis, we know that, as our chair likes to say, we're not immune to the impacts of racism and sexism and discrimination and oppression and homophobia, whatever it is. We're not immune to that because you walk through the doors of Multnomah County. Certainly, I didn't walk through the doors of this Portland State office building and be like, whew, racism doesn't exist here. Right? Go have a drink. You don't walk through the doors of these institutions and all this stuff goes away. So what we recognize in our process is that we were going to focus and center the voices of those most impacted. Those are our employees of color, our immigrant and refugee employees, our older employees, employees with disabilities, our LGBTQ employees. In fact, we have a group for veterans that also talk about different impact. And because we had done the investment, because we had this infrastructure of employee resource groups that were literally organizing each other, building connection and affinity, we were able to activate them. And I'll tell you, when I came in on September 14th, which is when we passed a resolution and started this process 6 months ago, almost 7 months ago, our original outline was that we would have a project team and a steering committee and an executive committee and blah, blah, blah. Right? Like even myself, in trying to design a process that would move us from here to here in a short time frame, I built it as folks would have built it in other places. Very kind of white dominant, typical, dominant culture approach. I'm going to pull in some people that I like, who I trust. I think we'll give you good ideas, and we'll come out with something at the end, and everybody will love it. And I think what we realized on September 14th, because employees showed up, because community showed up, we realized that applying our own frameworks to this work means that it had to look different. Which means that when we say centering the voices, we mean that we staffed employee resource groups that held listening sessions and collected data. We staffed them to do kind of just-in-time training around qualitative coding and analysis. So they analyzed their own data and developed a set of themes. We used those themes for them to host strategy sessions where those themes that they developed then came with strategy ideas. Right? Their voices and ideas and concepts up on paper, what we call dotocracy, you vote with dots. It's their work. One of my first meetings with directors, they said, well, I showed them a process map and they said, well, where do we fit in? I said, well, you don't until the end. Like everybody knows that your leadership has to buy in. There's no way that we're just going to create whatever the hell we want and be like, hey, directors, go implement it. Right? We know that. But we also knew that if we wanted to maintain our fidelity to these values and principles, that we need to focus our work and build power, agency of individuals in our organization the most impacted. And we had the data to tell us. And I'm not going to rip off the data, but you can imagine. I made a short conversation with the ERG. These things are still happening. Right? And Multnomah County and Public Health Division are not, we're not so different. I don't know if we're so different. But these things show up. Right? There's people that feel isolated. There's people who feel like they can't get ahead. There's people that feel like my identity in and of itself creates a barrier for me and my success. That is not a complicated concept to understand. If you understand anything about our social relationships as a country, it shouldn't be hard to understand that your gender identity or your sexual orientation or your race or ethnicity or your accent, whatever that is, your disability, can make you feel like you don't have the same opportunity. And I think this work that I'm really proud of, and really proud of the work that our frontline employees did, literally, not literally, metaphorically showing the scars on their back to inspire change. That your trauma that you've experienced is going to mean more than just a data point. That we're going to rely on those stories, we're going to rely on those experiences to move our work. And like I said, at the end of the day, the strategies themselves are not like, they're not groundbreaking. They're the things that relate to safety, trust, and belonging. How do I feel like every day I can feel like I belong here? How do I feel if I raise an issue that I won't be retaliated against? How do I feel that the information I'm getting from my manager or supervisor is helpful for my professional development? They're not novel concepts, but I think the approach is really important. And I think when I met with the POC ERG, for me that's what's so inspiring for me. Is that if we invest in employees who are most impacted, we can come up with solutions to problems that have plagued our organizations for a long time. And we have employees that feel more validated, they feel more empowered, they feel more connected to the work. So it's powerful. And then this last piece, that's where we focused. And I tell you, organizational culture, the ways that organizations operate, that's a big one. Yeah. And we focus a lot on training, and that'll be part of what I often say is our collective lack of imagination. How do you change culture that really is focused around kind of dominant practice and behaviors? How we run meetings, how we communicate with each other, how we set expectations, how, We talk sometimes in our work about flattening hierarchy. And what does that look like? What does it look like to share power? It wasn't easy for me to, hear from ERG saying, you're not doing this right, or, we don't feel like we're being included right now. And I'm like, I'm including them. Tears running down. But when they felt they could speak to me in ways that would move the work forward, we did better. We ended up with a better product. It wasn't easy all the time. I'm like, I'm the Chief Diversity and Equity Officer. Right? But sharing power and building power is something that I think we can all struggle through. So I don't know where folks are situated in the organizational hierarchy, but think about, how am I doing that today? How am I sharing decision? How am I helping build capacity? How am I sharing information that's going to be better for someone else? We talk about it with succession planning all the time. If you retire without someone ready to come up and into your space, you haven't done your job. If you retire and you take a bunch of information with you, you have failed your colleagues. Because that meant we didn't share our information, because information in organizations is power. Relationships is power. Information is power. How to navigate, when to go eat lunch, and where can be power in organizations. So these are things, again, we can do every day. But this is a story, starting today and going forward, that I hope to tell over and over and over again. And I hope that folks in this room will be telling that same story a couple of years from now. We were able to do this work because we centered the voices of those most impacted to change our trajectory, to change the experiences that we know our colleagues are having, let alone our community, right? This is, again, that literal, metaphor. These are the same things that we say in community all the time. Oh, we've got to engage, who's the most impacted community? Let's go engage the community. Let's go engage the community. And people said that for this too. Well, we've got to have community folks at the table. It's like, you know who our community is when we're talking about our organization? They're our employees. So yes, we have community partners and all that, but we centered it on our employees. I don't know why it does this. So I'm going to be really quick here because we're running out of time. I believe, when I say don't cut and paste, I believe that you should always be learning from folks that have done this work. We say, there's an old expression, I don't know who came up with it, it says share seamlessly and share, what is it? Steal shamelessly, yes. Share seamlessly, steal shamelessly. I can't get it right. Take 10, right? Contact her if you want to know. But the process of developing your tool, the process of developing your employee resource group, the process of developing a workforce equity strategy or any strategic plan, there's models and templates out there. People have done it. But the process matters. How people engage in it, develop it, I think is really important. It's something that I think I would always encourage folks to do. Seek transformation, not transactional. We're going to have a workforce equity strategic plan that is, ultimately, it's a transactional piece of work. It says it will do some stuff. That's not the end goal. The end goal is not to write some stuff on paper. The end goal is to actually see long-term change and impact that makes people's lives better. And that's whether it's in the workplace or outside of the workplace. That is short and long term. It always pains me to say, you know what, I hope that at least with my children's children, if that's a thing that happens, at least my children's children, maybe they'll live in a different type of world. It pains me, but that's real. I'm not going to be at Mullen-McConaughey forever. So I have to have both a long-term vision of what I can leave behind, what I can help build up, and recognize that each and every day I can make some change. I used to have a quote from, where's my brain now? Where James Baldwin, you know, and I butcher it every time and I try to paraphrase it, that's why I used to have a slide. But basically said if you could move by millimeters, you can move mountains. Which literally geologically is true. Right? Millimeters at a time, mountains can move. And so I think that's, you know, just holding that, to recognize every moment of every day we can do something to positively move this world into a better place. Being flexible, and I mentioned the kind of flexibility in our own kind of strategic plan development, knowing your purpose, creating and maintaining conditions, which is not just creating safe spaces or safer spaces, wherever the language is, to have these kind of conversations and dialogue, but taking care of each other and yourselves. One of the first times I told my staff, I'm leaving early on Friday, I need a mental health, just break. And they said, that is great. Thank you for modeling that behavior, and I will always give you permission to do the same. But this work is not easy. Anyone's doing health-based work, right? The vicarious trauma, dealing with communities and working with communities that are experiencing harm is damaging, and it's hard and difficult. And there's lots of not appropriate public health week things to do to take care of yourself. But more appropriately, go for a walk or take a look. Critical thinking and dissent. Certainly, if you're a manager and your staff doesn't feel like they can provide pushback, then you need some training. Failures are part of the process. I think anybody that's worked with me long enough knows that I excel in this area. I had a colleague that gave me a book when I took this job and said, fail again, fail better. And it was all about, Michael Jordan got cut from his junior high basketball team, and Bill Gates dropped out of college, and Einstein got held back in kindergarten. It's all about, the failure is an opportunity. Right? There's some cliche that somebody probably says it's much better than I did. But just recognizing that's part of the process. And what we have to be able to do is give each other the grace and permission to be able to fail and to make mistakes in service of a higher cause. A lot of these are the same. I think for everyone, letting go of needing to know the answer is so hard. Well, if you apply the equity lens, use these questions, and anytime you say, I don't know, it's super powerful. Super powerful. Just absorb that. And then the last piece, I do think that having a tool that you're able to use in an organization is important. I mean, one of the things that comes out of the equity lens, the questions and dialogue in and of itself is really powerful. Even if you're not making a policy decision around it, it's powerful. We used it to develop a strategic plan, again, most negatively impacted by workplace inequities. I think you could say the same thing in community. If you're developing community health improvement plans or strategic plans or whatever it is, how do you focus on those who are most negatively impacted? And then that last bullet, if there's anything that I would want you to leave today is that we can all do this work every day. And I hope my own modeling, public modeling, of my own deficiencies, limitations, blind spots, areas of growth, we call them lots of different things. I hope my own modeling gives you a little more permission to say, you know what, I have these too. You know what, growing up in this, with this identity has given me inherent advantages that I need to understand more deeply, that I need to work on, and I need to talk to others about. So I think we have incredible power when we do so. I don't think I'll have time for questions since it's 10:59, so you won't be able to grill me unless we have more time. But
are you sending out the slides?
I've shared them with the POC ERG, and so I'll let Julie and other folks navigate that piece. Do we have time for questions or no questions?